Hello viewers, welcome to Dimapur 24/7. This is your reporter Wangje Kunyak. Today, Nagaland Congress Party held a press conference here at Congress Bhawan in Dimapur. The main purpose was to discuss on the lack of basic equipments, facilities and lack of staff in Nagaland hospitals. They also mentioned that in most of the important hospitals like in Naga Hospital, Kohima and Zuneboto, the CT scan and ultrasound facilities are unavailable. They've also mentioned that 57 primary health centers in Nagaland are running without even a single doctor. So they also, in the press conference, they also have talked about other issues. For more details, let's have a look at the press conference.
A very good morning to all of you. Today we have with us my friend and colleague, Engineer Nation Lokat. He is the chairperson of the Public Grievances Department, NPCC. He has some very important things to share with you all. Also with us is our Dimapur DCC President, Mr. Kutuhal. And on my left, on the far left, is Mr. Andrew, Media Coordinator, NPCC. Let's start with our chairperson of Public Grievances Department. The time is yours.
Okay, sir, thank you. Okay, today we really want to focus on 2 points about health and family welfare department in Nagaland. So the number 1 point is lack of basic equipments that are required here in Nagaland. Okay, lack of basic equipments or material equipments that are required in the medical sectors here in Nagaland. And the number two is lack of medical staff like doctors, nurses, radiologists, technicians, all those. So regarding the first one, lack of basic equipments that are required here in Nagaland. Regarding this issue also, the first thing that I want to mention is last year on 4th of May 2024, we gave a press statement to the Naga Hospital Authority Kohima, telling them to restore the CT scan and mammogram at the earliest. But still then, till today, as of now, they have not restored the CT scan also and mammogram also. Now CT scan, ultrasound, all those are basic equipments that are required in a hospital. And it's not only Kohima being the capital does not have that facility, and it's not that we have not reminded them. We have reminded them many a times, because it's like playing with the life of the people here in Nagaland. From many other districts, they come to Kohima to get treatment. So in Naga Hospital, since they don't have CT scan, they are referred to some private hospitals. Now somebody who is not able to walk by himself, people used to take him, drag Kurina Gari de Rekina. That's how they do the CT scan and all. How much difficulty the people are suffering. So it's not only Kohima. Recently we have through some reports. See, even in Zuneboto there is no CT scan. Those are the things that are happening here in our state. And say example like just to get a CT scan, somebody has to come down from 150 kilometers away from the state capital. They have to travel a long distance. I'm just citing an example. Okay, there are so many other equipments, medical equipments, which I don't know the name also. It is not being provided here in our state. Now I just want to say, how long will this happen? Why? Because see, Nagaland is the state which got statehood before all other northeast states in Nagaland. I mean all other states in northeast. Nagaland is the first statehood paala first. But why? If there is a health issue, we don't get treatment here in our state itself. We have to go to Impal. We have to go to Shillong. See, taking example of Manipur, Nagaland and all, they got statehood only after us. There is something wrong with our system, is it? So through this press statement, I just want to remind the ministry concerned also. This health issue should not be taken lightly. Or See, example like there are at present there are 56 PHCs without even a single doctor. 57 PHCs without even a single doctor. How is that possible? See, one PHC, it takes care of more than 20 villages. At an average, it takes care of 15, 16 villages. So, without a doctor, how is the PHC supposed to run? Bustide thaga manon 13, 14 village day. If there is an emergency case, where do they go? That is the condition or the situation, the pathetic condition of our state today. So with this, I just want to tell the government also, stop taking the healthcare very lightly. Why not our state be like our neighboring states? We always see that there are some issues, there are some conflicts happening here in Manipur, but their technology is much, much better than us. They have medical college, they have engineering college, they have good medical facilities. Now what is wrong with our state? Okay, now that is concerning the first point, the lack of basic equipments that exists here in our Nagaland. Now the second point is lack of medical staff, lack of doctors, lack of nurses, all those things. Now government may take excuse. Now why is the medical department not functioning properly? They may make excuse that exams are not being made to be conducted. That may be their excuses. Yeah, for many years they have not advertised the post of doctors, nurse, staff, all those. They have not advertised. But it is their own making, okay, I will tell you. There are lack of doctors everywhere. And they will put the blame on the public, or they will put the blame on some associations or unions for not letting that special recruitment drive to happen. But it is all their, like I'm saying, it is all their doing. See, the reason there were many associations or unions who were against the special recruitment drive of 288 vacancies, which includes doctors, nurses, technicians, radiologists, all those. Now, going back to the first point, see, here example like in Zulaboto, it seems there is CT scan or all those facilities are there. CT scan is not there, but other facilities are there. But they don't have a radiologist to operate the machine. Those are the things happening. Now, see, they will say, government will make an excuse that they are not able to fill up the vacancies because of some certain associations, but it's never like that. The reason here is, in that special recruitment drive, they have said that they will give 175 extra marks to people who have worked during COVID time. Now, I think that is too much. It is almost like 36% of the total mark. Now you imagine yourself, you get 36% mark even before sitting for exam. How fair is that? Now, for COVID, some other states like Manipur and all, they have given a little mark to those people who work during the COVID. Say example like 10 mark extra. That is somehow acceptable, okay? But directly giving away 175 is not acceptable. And it is against the rule number 9 clause 4 of NPSC also. And it is against the rule number 16, article 16 under Indian Constitution also. It is a violation of that. So they may have excused that because of so many things they are not able to advertise those posts in a luck with you. Will be 2020 they gave an advertisement of how many posts? They gave advertisement of 186 posts. And clearly it is written that it is purely a contract for 12 months and no person has the right to ask for regularization. It's mentioned in the order itself. Now don't think that I'm against those people who are already working, who work during the COVID. I appreciate their work. Will be, say example, just taking example, my friend, he let's imagine he is a doctor. I myself also, I work under government of Nagaland. He work under private during the COVID. Now when we are going to sit for exam, I'm already given 175 mark extra in advance. Where will he go? Now we are humans though. See, those are the things. But still then, if the government was serious enough, it is already more than 1 year. They gave the order for special recruitment drive, but since many of the pressure group were against it, they were not able to conduct that special recruitment drive. Now it's already more than 1 year. What are they doing? They will have assembly. What resolution do they pass, or what benefit do they give by sitting in the assembly and discussing? These things are very serious, so they should actually be taking up these issues. So for us also, what we are saying is, at least the cabinets could sit, have a meeting, and come out with some resolution. Make way for vacancies, make way for all those vacancies to be filled up. Like I'm saying, see, 175 is not acceptable, and I don't think that will happen. So at least they have to make some arrangement, isn't it, if they are serious enough. And they cannot simply say that because of the associations banning this special recruitment, they are lacking in manpower. So like I'm saying, serious enough as equally to pila watahan discuss kurina ekta adjustment huli kurina special recruitment drive to huli paro thingsiula. They are not serious though.
Health, it's such an injustice, and it's such a tragedy that in this age of so much technology advancements in the medical field, here we don't have even the most basic of equipments. Of course, some private hospitals might have it, but as we know, the majority of our population are farmers. They mostly live in the rural areas, and it's a very big difficulty for people, especially those who live in the rural areas. There are certain diseases or ailments which can be so easily managed if it was given attention, treatment at the right time. But because of all this lack of basic equipments in most of the places in Nagaland, and because of these shortages of manpower, these minor ailments or diseases becomes worse, it becomes chronic, and so many people in the state are going through these difficulties. And of course, there are so many departments, there are so many sectors, but certain sectors like the health or the medical sector, and certain sectors like, for example, primary education, these things we should not compromise on. The government, it's the duty of the government to ensure that at least these basic infrastructures, basic utilities are given. There shouldn't be any excuse for all this. No excuse is good enough. These are basic things. It should be available. If our neighboring states, forget about other states, or if our neighboring states can have all these facilities, why can't we? This is just a matter of lack of accountability. This is a matter of misgovernance. This is a matter of utter and total neglect. So if you have nothing more to add, I think that will be all for today. We'll go to questions.
Like Mr. Clark said, over some specific particular hospitals where there is a lack of staff or doctors and nurses, or any particular hospital
in particular, which like equipment we have. Of course, you have mentioned Kohima, Naga Hospital Authority.
Acha sir, again mo ko nisna exact number do say 57 PHC na noy. PHC do doctor ta piswi nai. Aro ito example like ki piri nisna mokchun nisna noli zulbuto nisna ito handu do example basic equipment mu itia kwala handu nai do. Na
Aro
staff can be nisna kumba example like kumba PHC do nurse ekta ba chula se na doctor na thaka ba nurse ekjun dujun ba chula se inala pathetic condition aso aro mala problem ase kile health care ge interest na de moi tu na buji aro as per some report every year between the year 2023 to 25 bitore the department has spent between 40 to 240 crores 40 to 240 crores in upgradation of the equipments quasi only I don't know where they have upgraded
that's a big margin, 40 to 240.
yeah but they're not I don't see anything upgrade wala ko na dikhe
Just sir, so I'm going to watch special recruitment drive up because I guess is that those support drugs the one they kind of a bother. Our appreciation of their part should not be reduced to mere rhetoric. And following that statement from the Supreme Court, Ministry of Health and Family Welfare, Government of India, they directed every state to give preference to those COVID doctors. So I think your disagreement with the special recruitment drive is against, not directly against the government of Nagaland, but against the Union of India, government of India and Supreme Court.
Acha sir, see regarding that one we are not saying that we are against that as a party we are not saying that we are against the special recruitment drive. We have to think it practically. I already gave an example as in tai private te kam gurse moi government te kam gurse to same time de life risk kuna covid time de kam gurse na example since moi government te kam gurse to moi gidu 175 mark extra diye so based on that order that you have mentioned now other states has also came out with some special recruitment drive but the marks allocated was not as per the state of Nagaland moi condition Madhupura nisna
Never specified any particular marks to be given.
yeah that's why hulivi condition special recruitment drive la de marks man diwi gunai ko likhe na do tu yatela making is so tan jo bana example like Baba Kwazuli Manipur di tan di covid warriors kan thai doctors kan idon do under tan NHM de noli department la de kam kuri tharan ki do 10 marks nishna extra dishe ko to 10 marks gule do
The same advantages should be given to those private doctors also.
yeah because they also sacrifice no and it is going to be through Nagaland Public Service Commission so when I get a question if 175 is given to somebody it is a violation of the article 16 also equal opportunity in employment so no it will be violate so NPSC rule number 9 clause 4 will violate crazy too.
Yes, sir. That's all true. And it has been made.
But in short, see, what I want to say is, whatever it may be, rules can do. They are the one who are meant to make the rule how a state is governed. No, the cabinets. So it tell a special recruitment drive. Ladu Chadu, they can sit today if they are money concerned enough. They can sit today. They can have discussion, make some arrangement. Marks la hulibi ina hulido union association nambi chuchap thaki jao huli they are just to order to follow kurule pare na implement kurule pare na ini la pending ni rakhe so
It's been 4 years since 8 doctors have been recruited through NPSC in Nagaland. So right now they have to at least do sources can voice after recruit people in the Parata to this particular place. High Court ASEAN. So until the verdict comes out, no recruitment can be done through NPSC. That's what you can say. So tadi ki comment.
Nah, moi kuat isna sabi. Honestly, kim sago itu government tu na dimag tu bal side tu na biya side extra chulai tu tay. Example man kyo ekta kam gule court case kuri duo court pra stay order ani diu. Itu gane jamala huna jaze. Itu example like special recruitment drive pro buje. Some aggrieved doctors they have filed a court case against this also. If government is very serious enough, Nagaland rules and regulation who makes? The cabinets, na. Mentioning again and again, if they are serious enough, tonight, this evening also they can sit, they can frame all those criterias, what are the things or what changes need to be done in the special recruitment drive, and they can advertise tomorrow. That is the power of cabinet, na. But they are not doing it. So we are here to remind them the seriousness of this issue.
Sir, there has not been requisition of medical officers to NPAC for the past 3 years. Why is a medical department not able to requisition post of MO medical officer to NPAC instead of trying to regularize those COVID doctors? And it is clearly written on the contract that is for the 2 years.
See, actually, the story is like this. Even before COVID came, there were around how many vacancies? 24 MOs like that were vacant before this COVID came, and they already sent the requisition to NPSC also. But I don't know why they did not advertise. The reason NPSC gave was the one order came from the government side again, from the department, to withdraw all those. Now again after that, after the COVID, this contracted thaka ula khan nolibi ito hamra sob melai gina special recruitment drive gina ekta ahishuro. To tan itu special recruitment drive la excuse to lui gina aji topi advertise huli na pare je. So because of that, court case yate lagai dise exam ra tate ba dusra lagai dise ina hui gina pending ho so huli moi kwa nishina. Example, moi wa court case kursi huli, if the government comes out with something which is fair enough for the society or for the aggrieved doctors and nurses, I'm sure they will withdraw the court cases also. To moi ita kwa nishina tan ba kwa se NPSC they through dual. Also the NPSC they jaw lagi to because their pay scale is more than 2,800 na. Huli kwa nishina government la making his manula timag ba kheli ule na. Life sector to pi mala health sector to pi na kheli so. It's not a new issue na. Already punchina thakise uli au wapas nu ji daga. Sir, if we say like this, it may sound that we are against them uli na no. They can always sit for example na. But why ask for 175 extra mark? So manoi ki position hai tan medical. Mano magi head kuli pare they may head as uli condition for equality, transparency. Itu hi kota ko ase.
So last month there, Nagaland Insurance Doctors Association Canberra, akan praktek mereka belajar last month, I think last month, February next month. So Canberra, they have the same concerns that you have, lack of doctors and nurses. After that, that same statement, they came out in favor. It seems like they came out in favor of that the one-time special recruitment drive.
So Kiki association like you have mentioned, they are working under the department and they have pointed out so many things that are not in proper way within the department. No. If I'm not wrong, they have mentioned all those details, lack of manpower, lack of facilities, but regarding them supporting the one-time special recruitment drive to mo do na jene huli ko nisna balga babishik huli do fear hule se huli do moi ta example koi dise bishi bar koi dise example fear hule se government bi a lot negotiate when marks kan huli pat advertise ko dile bishi bal ho ni itu ko ase.
So this question is to the chairman, research department.
So sir, ये अपनी खुशी के
57 PHC though without doctor as in Nagaland.
So out of 100,
Almost 150. So sir, apni kan 57 primary health center de apni kan practically visit kuri saise sir.
nahi to the as per the reports mat be
Now apni kan laga findings kan to sir ite apni agiti bi koise. So NPCC bra government ke ki kobo mona ase. What should be the modalities that government should do to execute, to implement and bring doctors in all the PHC? What is your advice?
see moi ini calling mun thakar ase alak to serious ho lage health sector ase na noy alak department nishna noy example like PWD nishna hole manpower committee hole sama hui jawla. I don't know whether I am correct or not citing the name of the department. Will be health lalu सबसे important ase no health first ahe to na to itu example like 57 doctors na punche gwado example like itia 288 vacancy ase to itu pat fill up koriu na 288 to doctor nurse itu also pasu to example PHC ekta de 57 doctor nai to itu bi sab fulfill hui jao na hoy para to concern kuri na itu special recruitment draft apni naam ki dili takan kiba ekta kuri na pat itu vacancy to fill kuru lage aro every year pusa in terms of 1,000 crore de invest kore se upgradation ku dise facility kan alop serious lo lage ta hambi noile to not everybody has the money to go outside like them na. For a small mini heart surgery you have to go to Kohima. I mean you have to go to Delhi.
So apni kan 4th May 2024 de you have reminded the government to the action equal one. So NPCC bhi do you have any plans that medical concern ministry ke log pai gina do apni kan public law grievances to talaga table de put up kuru.
See, Jaina ta look the meeting rule le na la kuthabi no. If they don't listen to what we are saying, we will be compelled to go down to the streets. It was as simple as that.
Acha sir, mo ita question.
I think what you have stated so far, I'm assuming it's based on anecdotal references. But to force someone, especially the government, you need hard evidence na. So आपने इको investigate करना, RTI kan file करना, information तो उन्हें किना, इत्यादि पेश करना, government force करे भाग होए, आपने RTI लगाना ना लगाओ.
See, actually the RTI we easily manipulate video mano. No. And many of the people misuse RTI also. Oh, of course, if required, we can do it. Facts and figure. We take for example was a manpower committee. Itu mo ajiman kiki kuje itu we they should learn from this. Now number 2 CT scan na punche kusna mo kuku na punche tu evidence lage we na lage China sa hospital din nai do. To itu sai na tan action lo lage do. Aro kuku na punche what I want to suggest the public also apni ala jakari na punche gulu mangi information divi we will take up the issue. These days RTI also easily it can be manipulated na.
So just supplementing to my colleague, India Commissioner, sir, evidence is very important. Apuni kan hoy public law grievances karone apuni kan hala korili ase buji ase only sir apuni in the coming days NPCC bhi idu medical department laga lab district te thaka apuni bhi congress laga district te ase sub office to tate apuni kan ini crown report jayegina sir evidence ola boli pabana asna na.
Of course, yeah. Itu to grow lage. Ite example like man Jaina sukua dikhe to example like 2-3 jaga de district na thakala huli lagi sigulu to man pula tam devi nai kure no example like not only the medical sector we go to from district to district aro manu babio moi expose kure la to moi kila hota im na longi oppose kore na bi babi thegu na no huli we went to his place for some work তাদের লাস্ট স্কিম বেশি থাকিছে তো এক্সপোজ কৰিছে এতিয়া তো কামটো শুরু হৈ আছে just because we raised our voice against it কামটো শুরু হৈ আছে ইটো নিচিনা মান আজি মেডিকেল ডিপার্টমেন্ট লাগি কোৱা আছে আই এম sure they will respond বলা হিচাপতে নহলে তো মই আগিতে কোৱা নিচিনা এভিডেন্স বি কালেক্ট কৰিব লাগিলে we will go down to the streets না
So India medical laga topic no itu alak topic ase DCC bura town hall laga issue take up korise and then they have evidence on the RTI findings that even though 19 crore 90 lakhs 99,999 pilaise itu DCC ba kaise bishi pilaise itu ba dan logote takan kuina ase ki sir ekta special team find form korbo lage where DCC be include korbo lage aru edu pa investigate korbo lage koi to NPCC ba ki koi dula upore.
See, I'm sure most of you were there during the other day's press conference. Tahan DCC kan ge inaga issue as a cover DCC kan ge interest kushe. They filed the necessary RTI and they got a reply. Based on that, they have given a detailed press conference. I won't get into all of that. All I can say is the NPCC is completely behind the DCC, and through this platform, I urge the government to take this seriously and do course correction.
Since you all have the proof already, everything from the RTI response, what's the next step apart from just telling the government that to give a explanation for it? There should be a legitimate step forward. Approach the CBI, right to the CBI.
Yeah, of course.
Will that be done?
Of course, everything is being considered. I cannot comment on that now, but we are doing whatever is necessary now. The PCC will discuss about this, and we'll decide on what the next course of action will be.
So itya MP Subungman Jamir bra MP LTP bra district kunba ge ambulance community use kuruli dina ase tade kunba district ke dia do through tribal apex body kan logot dishe bolibi sir ami kan itya kunba complaint bai ase ke those vehicles to district takan laga allocated area din hoina district hospital Dimapur de abandon kurna bishi rakha huni ase. So research department rabi ek par api sabole laga ekta bhavana asena na ek par tani umun jai.
Acha itila to moi Trespongi ko na hudira kudese really on his behalf because he had good intentions to give ambulance to all the districts. So far it has been delivered in 6 districts only. So as per his plan, he wants to give it to all the districts. I already even before he said publicly, I'm saying that okay, I'm sorry. That is what he is planning. Aro what is na medical some jagade medical la problem ase etu karone ta ambulance disile aro Dimapur te jama kori ase go etu to thik na hola etu to mane etu to ma line PCC saipra holibi ini inquiry gorna ki koro lage kurile bal na ole it is meant to be used for public service, not to be stationed here in Kohima and Dimapur na sab ki dule so.
Last question, sir. Itya Lok Sabha election pasote lone seat Congress kan jitise aru apuni India age dekwa nishina elected member purabe district the first phase MP LTP la ambulance dishe aru apuni ko ase all 18 districts pabo bolibe itya MP ta thakabra apuni kan aha samede Congress kan be district ki kam korna jabole ase progress kinika chuli ase olop update dibo sir.
See, for us to see, we believe in issue-based politics. Aro ini mami ni dikhedo hoy seniors kala blazing lage. Really mostly Congress to man itya youths kan melai gina public la issue kan take up gina not only promising pila de manual la train nishina false promises gina ahala noina. Even if we don't have a single seat in the NLA, we're acting the role of an opposition till today. If we're not acting the role of an opposition, who will ask question to the government? No. We ask question to the government, aro itu pichide kinako itu bi tan respond dire to man opposition la role he play green ahe se ji. Aro ini so far it is going very well. Dimapur DCC hambi membership drive grise, and I hope very soon mala PCC la directive ahile do sub district bi membership drive bi thagiola. We want our party to be issue-based politics, not that false promises wala. Itu sih.
So basically, there are different phases to a campaign, and as political parties, we are always on campaign mode, in a way. Now, what we are concentrating on now is to revamp and rebuild the party. Whatever we have observed from the assembly elections, last assembly elections, we have observed, we have studied, and we have, identified some loopholes. We are trying to work on that. That is number one. And beyond that, we'll continue to raise the issues that are close to the people. We'll continue to raise the misgovernance of the government. We'll continue to, highlight the corruptions of the government of today. But apart from that, we also know that we need to find solutions. That also, we are working on a plan. We will continue to give hope to the people. We have a vision for the state of Nagaland. So all these three things are going to go in tandem in the next 3 years.